Yes, boys. Now क्या हो गया? Today we will talk about the vagus nerve, very vague in quotes. It is the largest or longest cranial nerve. The course of the cranial nerve is extending from brain to the abdomen. So you can understand how long this cranial nerve. It is very extensive in its course, extending from brain to the abdomen. The part of the abdomen which is supplied by it are left upper two-thirds, or you can say left 2/3 of the transverse column. When you will talk the abdomen, you will see that there is the transverse column which is present transversely. So I am telling you that vagus nerve is supplying up to the upper or left two-thirds part of the transverse column. The rest of the part nerve supply is different. All right. This 10th cranial nerve, which is extending, starting from the brain, and the part of the brain from where this nerve comes out. Look the diagram. This is the brain stem, as we have already talked. This is the part of medulla oblongata. This is the pyramid part of the medulla oblongata, and just lateral to the pyramid, this is the olive part of the medulla. You can see that there is a line between the pyramid and olive. This line is called anteromedian line. Anteromedian line. In the anteromedian line, you are seeing the rootlets of the nerve. दिख रही है आपको? This is the hypoglossal nerve. So hypoglossal nerve comes out from the brain stem through the anterolateral sulcus, and this is the anterolateral sulcus, and just lateral to the anterolateral sulcus, or just lateral to the olive, and on the more laterally there is the part of cerebellum, inferior cerebellar peduncle. So this sulcus, this is called posterolateral sulcus. So I have talked about the two sulcus. One is the anterolateral sulcus, another is the posterolateral sulcus. The nerve which comes out through the anterolateral sulcus is the hypoglossal nerve. That is this one. And from the posterolateral sulcus, as you have already discussed yesterday, the three nerves are there. Uppermost is the glossopharyngeal, 9th cranial nerve. Below the glossopharyngeal, you can see the rootlets of the vagus nerve, 10th cranial nerve. And more below it, there is the root value of the part of accessory nerve. So 9th, 10th and 11th cranial nerves, they comes out from the brain stem through the posterolateral sulcus. Uppermost in the posterolateral sulcus, that is the glossopharyngeal nerve or the 9th cranial nerve. In the same line, below the glossopharyngeal nerve, there is the 10th cranial nerve, vagus nerve, and more downwards there is the 11th cranial nerve or the accessory cranial nerve. So all these three nerves, they comes out from this part. After coming out from the posterolateral sulcus, the vagus nerve is passing forward and laterally in the cranial cavity. Then it comes out or leaving the cranial cavity through the jugular foramen. What are the nerves comes out through the jugular foramen? 9, 10 and 11. So it comes out from the jugular foramen. The one more thing, the part of the accessory nerve, that is the cranial part of accessory nerve, comes along with the vagus nerve and leave the cranial cavity through this jugular foramen. After leaving the cranial cavity, the nerve, as it comes out from the jugular foramen, it is having the two swellings or two enlargements. One enlargement is lying in the jugular foramen and another is below the jugular foramen. See here, this is the part superior ganglion, and the superior ganglion is smaller in size, and below the superior ganglion there is the inferior ganglion, which is larger and lying just below the jugular foramen. Now the point is this: what is the importance of this ganglion? These ganglions, they are having the cell bodies. They are having the cell bodies of sensory fibers. What about the sensory fibers coming through the vagus nerve? Their cell bodies are lying in the superior ganglion and inferior ganglion. The superior ganglion is receiving the sensory fibers, general somatic afferent fibers, general somatic afferent fibers, while the inferior ganglion is receiving, or it is having the cell body for the visceral afferent fibers. Okay. Rest of the part of nerve, it is passing downward in the neck, and as the nerve running in the neck, it is covered by, or it is lying in the carotid sheath. As the nerve comes into the neck, as you have already seen in the dissection, as the nerve comes down, it is lying in the carotid sheath. But still the teacher is not sufficient. When we see in the carotid sheath, in the upper part of the carotid sheath, the nerve is lying between internal jugular vein and internal carotid artery. Internal jugular vein lying laterally and internal carotid artery. As we go down in the neck, the pattern is changed. The nerve is lying between the internal jugular vein and the common carotid artery. All right. As the nerve comes at the root of neck, as the nerve comes at the root of neck, this nerve on the right side and left side, the entry is different. Listen carefully. On the right side, the nerve is crossing the first part of subclavian artery. Remember, you will see this part in the dissection of the thorax. So, on the right side, or you can say the right vagus nerve coming into at the root of neck by crossing the first part of subclavian artery. Then it comes into the thorax and then the part of abdomen. On the left side, the nerve is descending downward and it is crossing the arch of aorta. It is crossing the arch of aorta. And rest of the course is straight. Look the diagram. This is the right vagus nerve. This right vagus nerve, as it is descending downward, this is the part of carotid artery, and look here, this is the subclavian artery. So on the right side, the nerve is crossing the first part of subclavian artery. I will talk later on. You can see the branch of it, which is hooking this subclavian artery ascending upwards between trachea and esophagus, tracheoesophageal groove. That is the right recurrent laryngeal nerve. That I will talk later on. And on the left side, as I told you, that nerve is descending downward between the left common carotid artery and left subclavian artery and reaching downward, crossing the arch of aorta. So that is all about the course of the nerve. But as we first of all talk about the functional component of the nerve, let's see. This vagus nerve, which is a mixed nerve, no doubt, it is also a mixed nerve. And this mixed nerve is having both type of fibers, motor fibers and sensory fibers. The motor fibers of the nerve, they run, or the efferent fibers. Can I use the word efferent fibers? Efferent fibers of cranial cavity of the vagus nerve, they descend downwards and they supply along with the parasympathetic fibers of the nerve. Now see the component of the nerve. The nerve is having the, first of all, it is having the part of this nuclei. This is the part of the nucleus ambiguous and the dorsal nucleus of vagus, nucleus rectus solitarius, and spinal nucleus of trigeminal nerve. So, first one, that is special visceral efferent fibers or the special visceral efferent component. These fibers, I am telling you the different components. First is the special visceral efferent. These fibers, they arise from the dorsal nucleus of vagus nerve. See the diagram. This is the nucleus ambiguous, and nucleus ambiguous, this is the diagram of medulla oblongata. This nucleus ambiguous is located in the medulla oblongata, and from it the fibers arise. These are special visceral efferent fibers, and they are supplying to the muscles of palate, pharynx, and also the larynx. So muscles of the pharynx, larynx, and palate, all these are supplied by the fibers, special visceral efferent fibers. Second, the general visceral efferent fibers. The general visceral efferent fibers, they are coming from the dorsal nucleus of vagus, and these fibers, they are supplying parasympathetic fibers to the heart and also to the bronchial tree and the part of GIT. Dorsal nucleus of vagus, general visceral efferent component, and this component supplying parasympathetic fibers to the heart, bronchial tree, and also to the GIT. This one. Then, so these are the two motor fibers, and now come to the part general visceral afferent. As I am using the word general visceral afferent, that means it is carrying the sensation from the part of look here, general visceral afferent. These are carrying the general sensation from the pharynx, larynx, and trachea. No doubt, the motor fibers, they are supplying to the muscles of pharynx, larynx, and this. But if you take the heart, any hot thing, you will feel the stimulation. That sensation are passing through the general visceral afferent fibers, and through these fibers, where they relay in the nucleus rectus solitarius. They relay into nucleus rectus solitarius. So this is the general visceral afferent. Next to that, there comes a part of the general sensation from the auricle. That is called, and this general sensation from the ear, they relay into the spinal nucleus of trigeminal nerve. That is also located here in the medulla. Then very important, special visceral afferent. As you know, the anterior 2/3 part of the tongue, taste sensation are carried by chora tympani. Lingual nerve is carrying the general sensation. Pain, touch, temperature sensations are carried by the lingual nerve, and the taste sensation from anterior 2/3 part of tongue is carried by chora tympani. So, the posterior 1/3 part of the tongue, The taste sensation from posterior one-third part of tongue and also the velvet papilla and from the part of epiglottis. These taste sensations are carried by glossopharyngeal nerve. We have done. And the general visceral, these fibers, and from that the general sensations are carried by the vagus nerve. So after seeing these functional components and the course of the nerve, then I come to the part that branches given by the vagus nerve. As we have talked already that it is a mixed nerve having both type of fibers. Now see, as the nerve comes out from the jugular foramen, there are the two important branches which are coming from the superior ganglion. So only two branches are coming from the superior ganglion, rest of the branches are concerned with the inferior ganglion. These two branches, one is the branch, meningeal branch. This meningeal branch which is arising from superior ganglion, but it is again enter into the cranial cavity. देखिए ब्रांच कहाँ निकल रही है, just below the jugular foramen. First of all, it comes down from the jugular foramen and ascending upwards or goes into the cranial cavity again through the part of jugular foramen, and as it comes into the cranial cavity, it gives the branches, meningeal branches, to the dura mater of posterior cranial fossa. There are three meninges which are covering the brain. You have read in previous classes dura, arachnoid and pia mater. So the dura mater of posterior cranial fossa is supplied by this meningeal branch of the vagus nerve, and it is coming from the superior ganglion. The other second branch which is coming from the superior ganglion is auricular branch of vagus nerve. This nerve is very important and it is having the different name. First is auricular branch of vagus nerve, and also named on the old man of ancient time, elder man's nerve. Elder man's nerve, you can see here, देखिए ब्रैकेट में लिखा हुआ है elder man's nerve. That was the old person of the ancient time. What he did that put the eyes just behind the ear, just put the eyes drop just behind the ear to stimulate the appetite. खाने से पहले वो cold ice drop रखता था यहाँ. That stimulates the vagus nerve, and due to stimulation of the vagus nerve, the appetite also increase. Because of that, it is named as Elderman's nerve also. Now see the course of this nerve. This auricular branch of vagus nerve, see the course. It comes out from the superior ganglion and enters into the on the lateral side of the jugular foramen. On the lateral wall of the jugular foramen, there is present mastoid canaliculus. So nerve, after coming out from the superior ganglion, pass into the mastoid canaliculus, enters here, and again comes out from the ear through the tympanomastoid suture. As the nerve comes here, at the tympanomastoid suture just behind the ear, it's supplying here cutaneous supply. Okay, but it is still not sufficient. As it comes out through the tympanomastoid suture, the nerve gives here the cutaneous supply. Again it enters into the cranial cavity or middle ear. After giving the cutaneous supply here, the nerve again comes into the meatus of the ear. As it comes into the meatus of ear, here it's supplying nerve supply to the floor of the meatus and also the small part of tympanic membrane. And that will be difficult for the doctors. How? When the doctor is doing the syringing of the ear, patient comes to you, sir, something is remained in my ear. What the ENT doctor do? They do the syringing of the ear. If the doctor do the syringing of ear very forcefully, that can stimulate the vagus nerve. Auricular branch of the vagus nerve can be stimulated, and due to stimulation of the auricular branch of vagus nerve, either the patient shows the coughing, खांसेगा, or may vomit. If still the doctor is not stopped, there may be the cardiac arrest. The patient may die. So be careful. Listen carefully. Be careful while doing the syringing of the ear. Keep this thing in your mind that if the syringing of ear is forcefully, it can stimulate the vagus nerve, auricular branch of the vagus nerve, and that can cause the cardiac arrest also. So that is the auricular branch of vagus nerve or Elderman's nerve. Why it is called Elderman's nerve, that I have told you. Now come to the branches from the part inferior ganglion. The nerve is giving the different branches from inferior ganglion. First is the pharyngeal branch. The pharyngeal branch of the inferior ganglion comes down, running its course downward between the internal carotid artery and common carotid artery, coming down, and it is forming the pharyngeal plexus. It is taking part in the formation of pharyngeal plexus. I hope you know the pharyngeal plexus. Pharyngeal plexus is formed by the pharyngeal branch of glossopharyngeal nerve, pharyngeal branch of vagus nerve, and cranial part of accessory nerve. And what else? What else? Sympathetic fibers from the superior cervical sympathetic ganglion. All these join together forming the pharyngeal plexus. And from this pharyngeal plexus, the nerve are supplying to the different muscles of the pharynx, except, this is common question, except stylopharyngeus, which is supplied by glossopharyngeal nerve. कल ही तो आपने पढ़ी है, आज याद नहीं है. You have done this yesterday. So all the muscles of the pharynx are supplied by the pharyngeal plexus, vagus nerve, and one which is not supplied by the vagus nerve, that is stylopharyngeus. This pharyngeal plexus also supplied to the muscles of the palate. The vagus nerve, which is also supplying the part, the motor fibers to the palate muscles, and one muscle of the palate is not supplied by this pharyngeal plexus. Tensor veli palatini. Tensor veli palatini muscle, which is not supplied by the pharyngeal plexus, that is supplied by mandibular division of the trigeminal nerve, which comes along the nerve of the medial pterygoid. After this, from the inferior ganglion, one more branch coming supplying to the carotid sinus. The important one, see here, the another important nerve which is arising from inferior ganglion, that is the superior laryngeal nerve. The superior laryngeal nerve is the nerve of the fourth arch. Superior laryngeal nerve is the nerve of the fourth branchial arch, and this nerve is coming down its course and reaching up to the part of posterior part of the middle constrictor muscle. Look here, look this diagram. This is the trachea, this is the larynx, and this is the hyoid bone, and connecting the thyroid cartilage with the hyoid bone, this is the thyroid membrane. And lower down, this is the esophagus. Try to understand. You can talk later on, boy and girl, both of you. If you want to become doctor, read this carefully. I need not to say you again. So, this is the esophagus, this is the trachea, these are the muscle constrictor muscles of the pharynx. This is inferior constrictor, this is middle constrictor. So, look this diagram. This is the superior pharyngeal nerve. The superior laryngeal nerve, it comes down, reaching up to the posterior surface of middle constrictor muscle. After reaching here, it divides into two branches. The two branches, one is the external laryngeal nerve and another is internal laryngeal nerve. So very simple part, the superior laryngeal nerve, which is the nerve of the fourth arch, and coming downward, reaching up to the posterior part of the middle constrictor muscle. After reaching there, it divides into two branches, or give the two branches. One is the external laryngeal nerve and another is internal laryngeal nerve. The external laryngeal nerve, it is coming down and it is supplying to the part of inferior cricothyroid membrane. Look here, this is the cricothyroid muscle. So the main part, external laryngeal nerve coming down, and it is supplying to the cricothyroid muscle 1 and also the inferior constrictor muscle. These are supplied by external laryngeal nerve. The another one, internal laryngeal nerve. This internal laryngeal nerve, it is piercing the thyroid membrane. Look this diagram. The nerve is piercing the thyroid membrane. After piercing the thyroid membrane, the nerve is supplying to the mucous membrane of the larynx. And here it is important, and also underline that. The internal laryngeal nerve, which after piercing the thyroid membrane, comes in the larynx, and it is supplying mucous membrane of the larynx above the vocal cords. I am telling you above the vocal cords, that is very important, because below the vocal cords, the mucous membrane is supplied by recurrent laryngeal nerve, that I will talk later on, and this is commonly asked. What is the nerve supply of vocal cords above? That is from internal laryngeal nerve, and below the vocal cords, that is from recurrent laryngeal nerve. Besides this supplying and it is also supplying the mucous membrane of the larynx. Then I come to the two other important branches of vagus nerve. These are recurrent laryngeal nerve. First of all, see on the right side. On the right side, the recurrent laryngeal nerve is arising from the vagus nerve when this vagus nerve is crossing the first part of subclavian artery. So, the nerve is coming from the vagus nerve just below the subclavian artery, then it is hooking the subclavian artery, ascending upward and passing its course between trachea and esophagus. That is called tracheo-esophageal groove. So ascending upward through the tracheo-esophageal groove and supplying the part of the muscles. On the left side, the left recurrent laryngeal nerve is arising in the superior mediastinum from the vagus nerve, because as we have already discussed that on the left side, the vagus nerve is crossing the arch of aorta. So, the left recurrent laryngeal nerve arising from the vagus nerve, hooking the arch of aorta, ascending upwards, and reaching in the tracheoesophageal groove and coming upwards in the tracheoesophageal groove. Only the origin part is different. The course of the both nerves are same in the tracheoesophageal groove. And as it is reaching here, the recurrent laryngeal nerve, both first important part, they are supplying the mucous membrane below the or up to the vocal cords, lower part of the vocal cords. Besides that, they are supplying all the muscles of the larynx. Besides this, the another two nerves which are not shown here in the diagram, these are the superior cervical cardiac branch and the inferior cervical cardiac branches. Both these cardiac branches you will read detail in physiology. I am telling you just that they are on stimulation. They produce the inhibition of the heart, or they are the inhibitory centers of the heart. The superior cervical sympathetic branch, that is present in the upper part of the neck, and inferior is just below the neck. You can see also the course of these now. This is superior ganglion, inferior ganglion. This is the branch supplying to the part of the pharynx, larynx, and this. And the another one, look here, this is the transverse colon. This is the transverse colon. So it is supplying up to the right 2/3 part of the transverse colon. That is the supplying of the vagus nerve. So such extending codes that I have already told you. This is the arch of aorta. Look here, the left vagus nerve, it is crossing the arch of aorta, and this is the left recurrent laryngeal nerve. This is the left recurrent laryngeal nerve, and this is the right. Now I am talking of injury of vagus nerve. When the vagus nerve of both sides is injured, when the vagus nerve of both sides is injured, the patient feel or complain of nasal voice, नाक से आवाज आए, nasal voice, that is called nasal twang, T-W-A-N-G, nasal twang. Nasal twang, nasal regurgitation of solid fluid or solid liquid. पानी पिएगा नाक से निकल जाएगा. Nasal regurgitation of solid liquid. Flattening of the palatal arches. Flattening of the palatal arches. Hoarseness of voice. Hoarseness of voice. लिख लो मैडम, जो किताबें आप पढ़ते हो नहीं मिलेगा. क्या करते हो, क्यों आते हो क्लास में, और व्हाट पर्पज यू आर हियर. अटेंडेंस के लिए मत आया करो. आई विल गिव यू अटेंडेंस फॉर द कंप्लीट ईयर. सो hoarseness of voice, flattening of the palatal arches, so these are the symptoms which patient shows during the bilateral palsy of the vagus nerve. In case of, look here, you will understand because you are not seeing. These are the palatal arches. दिख रहे हैं आपको? These are the palatal arches and this is the uvula. So when we examine the patient, how we examine? Ask the patient to open his mouth and say ah, and by that time see the palatal arches of both sides are normal or not. Because normal person when open the mouth and say ah, both the palatal arches are elevated. ध्यान से सुन लो, फिर देख लेना. See in the mirror also you yourself whether the vagus nerve is normal or not. So, in the normal person, the palatal arches are elevated in the midline. If there is a paralysis of vagus nerve, on the paralyzed side, the palatal arch is downward. You can see here, dropped. Palatal arch is dropped. And another thing, at the same time, when the palatal arch is dropped on the paralyzed side, the uvula is deviated towards normal side. This side normal है palatal arch, so uvula deviate towards the normal side. So that is the way how we test the vagus nerve is normal or not. Okay. Now I come to the part, the cranial, the accessory nerve. 11th nerve, cranial nerve. The cranial nerve, look this diagram also. One more thing I have told you, the person is showing the hoarseness of voice and this. When we see laryngoscopy, that I will tell you later on in the larynx, when we want to examine the larynx, the instrument used is called laryngoscope and the procedure is laryngoscopy. So in the laryngoscopy, when the patient is showing that vagus nerve is paralyzed, in that case both the vocal cords, they are adducted, not abducted. And see this one, this is the one side vagus nerve is paralyzed. So on that side, the vocal cord is not abducted and remain patent in adducted condition. And this is the normal vocal cord. The patient in which the vocal cords are fixed, neither abducted nor adducted, as seen in the A. This is called the cadaveric position of the vocal cords. Cadaveric vocal cords, that I will talk later on, don't worry. I am showing this diagram that due to paralysis of both the vagus nerve, that is the condition which is shown by both the vagus nerve and the external laryngeal nerve. Both are paralyzed. In that condition, the vocal cords are permanently adducted, not abducted. That is called the cadaveric vocal cords. That we will talk again, don't worry. At present, you just understand that when the recurrent laryngeal nerve plus the external laryngeal nerve both are paralyzed, that will result into the cadaveric vocal cords. The person can't speak and this. That we will talk again. Okay. The accessory nerve or the 11th cranial nerve. This cranial nerve is purely motor nerve. What are the other pure motor nerves? One at a time. 3rd, 4th, 6th and 11th, 12th. Okay, good. So the accessory nerve is purely motor nerve, and this purely motor nerve is having the two parts, cranial part and spinal part. Cranial part and spinal part. The cranial part of accessory nerve, as we have already talked, that it's running its course along with the vagus nerve. The cranial part of accessory nerve running its course along with the vagus nerve and take participation in the formation of pharyngeal plexus. The spinal part of the nerve is having the different root or different site of origin. The nerve is also having the functional component, that is from one is fibers, that is the cranial part of fibers, they are arising from nucleus ambiguous. They are arising from the nucleus ambiguous and they take part in the formation of pharyngeal plexus. While the spinal part of the nerve, they arise from the ventral horn of upper 5 cervical vertebrae, cervical cord. They take the ventral horn of the upper 5, C1, C2, C3, C4, 5 ventral horn from the spinal cord. And from these, the rootlets comes out, they join together and running its course in the vertebral canal. They are running their course in the vertebral canal, passing through the foramen magnum and comes into the cranial cavity. From the cranial cavity, the nerve comes to the part of jugular foramen. As the nerve comes in the jugular foramen, this spinal part of accessory nerve joined with the cranial root of accessory nerve. It joined with the cranial part of accessory nerve for a short time. After this, the nerve leaving the jugular foramen comes out. As it comes out, both the part, cranial part and spinal part again separated. They just do the formalities. They just join with the cranial part in the jugular foramen. As it comes out from the jugular foramen, the spinal part separated from the cranial part. The cranial part of the nerve running its course along with the vagus nerve. Okay. Now, as that we know that the cranial part of accessory nerve, that is supplying to the muscles of palate, pharynx, larynx and all that along with the pharyngeal plexus. And the spinal part of accessory nerve, it is first of all leaving the cranial cavity, coming in the floor of the cranial cavity, and then first is coming into the part, for a small part it is coming in the carotid triangle. Afterwards it comes into the posterior triangle of the neck, and just let the upper 2/3 and lower 1/4 part of the sternocleidomastoid muscle, it is piercing that and comes out and reaching to the anterior border of the trapezius muscle. So it is supplying the motor fibers, both sternocleidomastoid muscle and also the trapezius muscle. But one important thing I am telling you here, because most of the time when you speak, the teacher will ask you, all right, they are supplying the motor fibers. What about their sensory fibers from the two muscles? They are very important. So what happens? Look here. This spinal part of accessory nerve, it is communicate with the C2, C3 and C4 fibers, which are carrying the proprioceptive sensations, from these muscles. The C2 and C3 fibers, they join with the sternocleidomastoid muscle, and C3 and C4 for the trapezius muscle. So that is the course of accessory nerve. When there is injury of accessory nerve, the patient may show the wry neck, WRY, wry neck. What is the wry neck? If you ask the patient to tilt the head towards the paralyzed shoulder side, the person cannot tilt his head. When you are tilting the head to one side, what is the direction of your face? To the opposite side. करके देख लीजिए. If the nerve of one side is paralyzed, the person cannot tilt his head on the paralyzed shoulder side or on the paralyzed side of the shoulder. That is the wry neck. So you can test it the sternocleidomastoid, but how you will test it the trapezius? The trapezius they do the shaping of the shoulder, and this shaping of the shoulder is done by the trapezius muscle. So to test the sternocleidomastoid and trapezius, doctor keep pressure on the one side of the shoulder and ask the patient to tilt his head towards the distant side. Normal person can tilt, but if the accessory nerve is paralyzed, the patient will not able to tilt his head. Okay, and same thing for the trapezius. Keep the pressure over the shoulder and ask the patient to shrug the shoulder. Normal person can shrug, but if the accessory nerve is paralyzed, they cannot do. But one more condition is there, that is very rare. That is called spasmodic torticollis. Spasmodic torticollis. In spasmodic torticollis, the patient is complaining of wry neck repeatedly. I hope you understand wry neck. Okay. So in spasmodic torticollis, the patient complains of wry neck repeatedly, and this is result to the lesions involving the central lesion of the accessory nerve. If there is the involvement of the lesion of accessory nerve in the part of medulla, that can result into spasmodic torticollis. So that is all about the same thing which we have taught, the general somatic reference to the sternocleidomastoid and trapezius, and special reference to the same through the pharyngeal plexus muscles of palate, pharynx and larynx.